Shalom, I am Professor Dani Filc. I'm a member of the Department of Politics and Government at Ben-Gurion University and of the Center for Health, Humanism and Society. I want to address mainly the socio-economic aspects of Israel's way to cope with the COVID-19 epidemics. In fact, I think that there is at least the best policy in order to cope with the virus includes social isolation and some sort of quarantine, and that has a significant economic consequences. Many of the workers are not going to work, and the question is how you cope with that. Israel has adopted a very problematic way to cope with that due to the fact that government officials, mostly at the Ministry of Finance and at Bank of Israel, are still within a very, very conservative view of orthodox view of economics, thinking mostly in terms of monetary policies instead of fiscal policies, and stressing the idea that there's no reason that Israel should increase its budget deficit, but you can't cope with extraordinary situations with ordinary measures, whether those are real, those are true. I don't want to enter the discussion whether those assumptions are correct in normal times, but what is clear is that this is not a normal time, and since it's not a normal time, we should use extraordinary measures. And as we know from other countries such as the UK, where we have a conservative government that usually is against fiscal policies and state intervention, and still within this situation they have changed their approach. In Israel, the government is changing its approach very, very slowly, and the consequences are dire. For example, we have now 25% of the working population, even a little more, 25% of the people receiving wages. Sorry, we have 25% of the working population in some kind of unemployed situation, and this is even more if you take into account freelancers and self-employers. The answers provided by the government are not enough. They are changing due to public pressure, but they are changing slowly, and even that it is not enough. For example, the way to cope with people working for wages that have been fired, or that they have been sent to licenses without perceiving the salary, is through the National Insurance Institute giving them unemployment payments. But the unemployment payments are problematic because they discriminate between the younger and the older workers, because they do not cover people who didn't work, who work for less than a period of 6 months before the coronavirus epidemic, because they, and mostly because people feel a lot of insecure when they are fired, or when they are sent to forced license. In that sense, for example, the Canadian or the British way to cope where enterprises and firms are paid by the government to be able to maintain the workers within work. And for example, in the Denmark case, employers paid 15% and the government paid 75%, so workers receive 90% of their salary, but they are still employed. It's a much better way to cope with the situation than the way that the Israeli government has adopted. And the figures show that that would increase the budget deficit in something like 3 or 4% of the budget. And in the case of Israel, the share of debt from the GDP is relatively low. It's around 60%. So it could use either an increase in the debt or a monetary quantification by the central bank, in fact, emission, in order to cope with an extraordinary situation. That would be much better, both in terms of the economy, but also in terms of individual health, in terms of family health. We know that unemployment and remaining in home are a kind of explosive cocktail in terms of family violence, in terms of gender violence, in terms of child battering. So those are questions that are part of our thinking in terms of public health that require that the economic issues be addressed differently than Israel has done until now. A second point is that while the government has announced a $10 billion shekel investment in the public healthcare system, this investment is focused only in fighting corona. It's okay, we need that money, but that does not address the problems with which the Israeli public health arrived to the corona crisis. We have an underfunded system. We have a severe problems in terms of hospital capacity. We had a public health system within the Ministry of Health that has been underfunded, and with people having been fired and reduced to its minimum. We have a severe problem of the number of nurses per population, and we are facing a problem of lack of doctors. 50% of the Israeli doctors, almost 50%, are 50 years and more. So in a period of 10, 15 years, we will have a significant decrease in the number of physicians per population, and we have no national plan in order to cope with that. But even though we know that in order to be able to cope with that, we have to plan in advance, because those are problems that take time to be solved. So while the government has committed itself to invest in fighting coronavirus, it didn't show the same degree of commitment in order to face the problems, the infrastructure problems of the Israeli healthcare system. So those are questions that should be addressed in order to think not only in terms of the next months, but thinking in terms of the next 2, 3, 4 years. Now, the need to invest in the public health system is because if there is one thing that we have learned from the current crisis, is the importance of the public health system. The public health system is much more efficient and for sure much more equal than the private one. In fact, in countries where the private system is the most important one, like the US, the crisis has been much worse. In places where they have had a relatively developed private system, such as Singapore, the responsibility for coping with the crisis has been given to the public system, because the public system is focused on providing health, while the private system is focused on providing profits. And I think that another important issue is that while decades of neoliberalism and underfunding have made for some sectors of the Israeli population to see the private system as more cool, more interesting, more appealing, more ready to, more responsive. I think that one of the great conclusions or the most important conclusions of the present crisis is that the people, the public, is changing its views about the public system, and in many ways nurses and doctors and public health workers have become the new heroes. If in Israel we are accustomed to see soldiers as the heroes, now we have a kind of civilian heroes, which are the workers in the public healthcare system. And I hope that that will remain as a memory and as an insight that will influence future policy. So thank you very much for your attention, and shalom, and we hope that here and everywhere we'll be able to see better times.